And with that, I appreciate the indulgence of my colleagues from Minnesota, but I want to yield to him for any additional comments he might want to make in this area.
Thank you, Senator Dodd, and thank you for your leadership on this bill. I want to talk about Senator Mikulski's amendment. First, just a little bit about some of the claims that have been made on the floor today about Medicare. And Senator Dodd just pointed out that in the Bush budget, last Bush budget, there was a bigger cut to Medicare, but not in the context of any kind of health care reform. Now, Senator Baca said it so well about what part of these cuts are. They're to hospitals because, and the hospitals are fine with it. They don't, as he said, they're not jumping up and down excitedly about it, but why are they fine with it? Because it comes in the context of health care reform. And we're covering 30 million more people. What does that mean to hospitals? That means when these people come into the emergency room, they have coverage. The hospitals get paid. That's the context in which we're doing this. Whereas when President Bush was proposing those kind of cuts or savings or whatever you want to call them, they were not in the context of ensuring 31 million more people who, when they go into emergency rooms for the most inefficient care possible, and won't be now, we're costing every American family $1,100 in insurance. You're comparing apples and oranges, folks. We're doing so many things, and Senator Dodd just talked about what some of the things this bill does. I want to talk about Senator Mikulski's amendment, because women are among the most severely disadvantaged in our current health system. Right now, health insurance companies can and do discriminate against women solely on the basis of their gender. Right now, it is legal in many states. And again, it's in many states, not in all states. This is why when you're talking about getting health insurance from another state, you got to be careful. In Minnesota, we have high regulations. In other states, you don't. In many states, it's legal to charge women higher premiums or deny them coverage at all if they've had a C-section. It's a pre-existing condition. If they've been the victim of domestic violence. In many states in this country, an insurance company can deny a woman coverage because she's been the victim of domestic violence, because it's considered a pre-existing condition. Well, that's just wrong. And I'm immensely pleased that under this bill, for the first time, women will have access to comprehensive health benefits, including maternity care, without having to pay more than their male counterparts. But we can do even more for women's health in this country. Senator Mikulski's amendment would improve the bill in making sure that women can get preventive screenings they need to stay healthy. Most importantly, the amendment will make sure that women have access to these life-saving screenings at no cost. So it doesn't interfere with a woman and her doctor, as my distinguished colleague from Texas just said a few minutes ago. It makes these screenings available at no cost. Why is this important? Because right now, women are delaying or skipping preventive health care because they can't afford it. That's not just bad for women's health, that's bad for our system because it drives up costs unnecessarily. Even in Minnesota, where we generally do a good job with health care, there are women in my state right now who are not getting the care they need. They're skipping their annual exams because they're uninsured. And women who are uninsured are twice as likely not to get the care they need. Other women in Minnesota simply can't afford the coverage they have now. Just since 2007, the number of women who have delayed or avoided preventive care because of costs has doubled. And the economic crisis has only made things worse. But the economic situation is no excuse. The reality is that women are foregoing preventive services that could save their lives because of the way insurance works now. And make no mistake what that is about. From 2000 to 2007, health insurance companies saw their profits increase 428%. And women are foregoing preventive measures that could save their lives. Is this the kind of country we want to live in? Now, there was some good news yesterday. The Congressional Budget Office confirmed what many of us already knew, that with the insurance market reforms and subsidies in our bill, women will be able to purchase better coverage at a lower cost than they'd be paying without the bill. That's huge. And with Senator Mikulski's amendment, we will go even further, guaranteeing that women receive preventive care when they need it without barriers. These screenings catch potential problems like cancer as early as possible. This saves lives, and, by the way, it saves money. For example, cervical cancer screenings every 3 to 5 years could prevent 4 out of every 5 cases of invasive cancer. And regular screenings could prevent more than half of the cases of infertility. Senator Mikulski's amendment will give women the care they need when they need it. This is a huge, huge step forward for justice and equality in our country. It's also a top priority for me that health reform includes another crucial women's health service, access to affordable family planning services. These services enable women and families to make informed decisions about when and how they become parents. Access to contraception is fundamental. It's a fundamental right of every adult American. And when we fulfill this right, we are able to accomplish a goal that we all share, all of us,
15 minutes
both sides
expired.
of the aisle.
15 minutes has expired.
My apologies to Senator Dodd. I guess as a freshman, not necessarily familiar with all the rules, but I think that means I must yield the floor. Is that right, Mr. President?
That's correct.
Mr. President.
In that case, I do, to my good friend from Texas.
Mr. President, I don't think there's a time agreement here. I think
I made a consent for time agreement.
I'm sorry. I'm sorry.
You know, it's fine. There'll be plenty of time. I suspect we're going to have a lot of time to talk about this bill.
I think so.
But I appreciate the comments of my colleague from Minnesota. Very well said.
Thank you.
Senator from Texas.